Hello, my name is Craig Ritchie, and I'm Professor of the Psychiatry of Ageing at the University of Edinburgh, and also the Director of Brain Health Scotland. Over the next 5 minutes, I want to tell you about this new initiative that's launched in Scotland in April of this year, which is based on sort of one observation and two principles. The observation is that from research findings that have been going back many years, we're now fairly confident, very confident, in fact, that the diseases that lead to dementia in later life have their genesis in midlife at least. And if we were able to detect and manage those diseases in midlife, we would be in a very strong position to prevent dementia. To do this are the two principles. Number one is that we need to address this at a public health level to look at how we can modify risk factors in the community, but also work at an individual level through brain health services and brain health clinics, where we can identify an individual's risk and put in place what we call personalized prevention plans. And I think the starting The starting point, as I said, from a research perspective, has been the accumulating evidence over the last 10, 15, 20 years that the features that, or the diseases that lead to dementia at least start in midlife. And we often describe them being a long silent period of disease before cognitive impairment and dementia develops. But one could argue that it's only a silent period because we're not listening properly. And had we the tools and the willingness to look for disease in these earlier populations, as we do in research studies like Prevent Dementia and EPAD, the European Prevention of Alzheimer's Dementia Programme, then we are hearing signals or seeing things that take place in the brain many years before dementia develops. And what we have to do is be able to take multiple different features of an individual, the risk profile, both fixed and modifiable risks. So fixed risks would be, for instance, your genetic history, your family history. And modifiable risks might be your lifestyle, the smoking, diet, exercise, and even medical comorbidities like diabetes and psychiatric illnesses like depression are all risk factors, as we know, for neurodegenerative disease that may progress if untreated to dementia. We also have to look at how these diseases present themselves through symptoms like cognition and function and behavior, sleep change, apathy, anxiety, and also how they express themselves in the brain itself through biomarkers like in the CSF, looking at proteins like amyloid and tau, or looking at how the brain may shrink in certain areas secondary to the disease process. And what we're going to do at Brain Health Scotland is, through government support, is put in place assessments, I should say, at both a personal level, but also a public health level. And this will cover the spectrum from primary prevention, which is for people who are maybe at risk but haven't started expressing disease, to those who maybe got the early stage of the disease, but not yet a full dementia syndrome. What this slide is trying to illustrate is that how on the left-hand side, more the primary prevention stage, you're very much looking at public health interventions, working with government, public health agencies, the food sector, the leisure industry, local authorities, etc., to see how can you modify risk factors at a population level. And then you move to the right and you think about maybe some people who are at higher risk coming in and wanting some advice or support through what we call brain health services. And assessing those individuals might yield some individuals people who may be at even higher risk because they maybe have early cognitive symptoms or they've got a strong genetic risk, and we're able to assess this. We might want to suggest they come to a brain health clinic for a fuller workup. And the important thing is that we don't want to set up any of these services in isolation of each other. What we won't want to do, and will be doing at Brain Health Scotland, is setting up these end-to-end full ecosystem, if you like, services, assessments, public outreach, communication and education as a whole package, if you like. And I think by doing so, we will achieve success. So just to close, launched in April 2020 after maybe 2 or 3 years of negotiation and discussion with the Scottish Government and other key stakeholders, Brain Health Scotland has been established within Alzheimer Scotland as a host institute or legal entity, which takes governance responsibility for our activities with Scottish Government. Scotland as a nation has a capacity to substantially improve brain health at an individual and a population level. We believe that the research, some of which has been derived from Scottish-led studies like EPAD and PREVENT, the unique informatics ecosystem and the coordination within the NHS with health systems can be brought together to address this global challenge, and this will be our path. Scotland is small enough to make a big difference to brain health and reducing the likelihood of severe neurodegenerative diseases across the world. And what we have to do, move away from is a 50-year focus on late-stage neurodegenerative diseases, namely dementia, and give way to the early stage of disease in order to fulfill the undoubted potential for prevention. Thank you very much.